Hi, my name is Hal Scherz, and I am one of the pediatric urologists here. I'm the senior pediatric urologist. I've been here for 30 years. I'm also the managing partner of Georgia Urology, the entire practice. Well, I think that as a pediatric urologist, you're managing not just the children's problems, but you're also managing parents. And that's why pediatrics is such a challenge for so many doctors because it's difficult to really deal with that entire dynamic of parents and children, but it's the most rewarding, I think, of all of the things that we do at Georgia Urology because we're changing lives. We're taking care of children and making them better, and the things that we do will last them a lifetime. So it's really a privilege and an honor to be entrusted by parents with the most important thing in their life, which is their children. Well, I have this hanging in my office, and this is an article that was in the one of the publications here in Atlanta, the Atlanta Jewish Times. And it is a story about myself and my former partner who retired because we did a community service to the Atlanta Jewish community. There were three families from Mexico that emigrated to the United States, and they were converting to Judaism, and they all needed to be circumcised. They didn't have the money, they didn't have the resources to be able to do that. So I was approached by my rabbi if I would be able to help them out. And of course, I jumped at that opportunity, and I made sure that I had all the arrangements made for all six boys to come to the Children's Hospital and get their circumcisions done. They didn't have to pay anything. I didn't charge them anything. This was all gratis. And the three dads who were converting to Judaism got circumcised by my adult partner, Dr. Barry Zitzholz. And this is one of the more meaningful things that I think I can say that I've done in the community as a combination of community service and my practice, my specialty. And it really was very moving for me. The family has been in touch with me. They're indebted to me, and it's really a very small thing for me, but it was such a big thing for them. Well, I think that as a pediatric urologist, you're managing not just the children's problems, but you're also managing parents. And that's why pediatrics is such a challenge for so many doctors because it's difficult to really deal with that entire dynamic of parents and children, but it's the most rewarding, I think, of all of the things that we do at Georgia Urology because we're changing lives. We're taking care of children and making them better, and the things that we do will last them a lifetime. So it's really a privilege and an honor to be entrusted by parents with the most important thing in their life, which is their children. I don't think that the things have changed. I think that the way that we take care of the problems have changed, but the problems in children are all the same. I don't think that if you look at a textbook of pediatric urology from 30 years ago and you look at it with thinking about problems that occur today, the problems are still the same. The treatments may differ, but the problems have all remained the same. I think pediatric urology is going to remain as a subspecialty in urology that is going to be predominantly reconstructive surgery. Now, whether that's open surgery or it's minimally invasive surgery, it's going to depend on the problem, the age of the patient, and the skill set of the doctor. The birth rate is going down in the United States, and I think that there is going to be fewer patients with pediatric urological problems. So there may be more competition for patients among pediatric urologists in different areas, which is why I think it's so critical, so important that the quality of a group is at the is the utmost, and I think that it's really important to emphasize that and to let the community know that, and I think that the pediatricians know that, but I think it's not enough. I think it's important to let the whole community know that. What I am most I think regretful about is the fact that I'm nearing the end of my career, and I see in Georgia Urology such an incredible future, so many things that are happening in our practice that are going to be a positive impact on urology, on pediatric urology, on the community. And I regret that I'm not going to be here to participate in that. And that's I wish I was 10 years younger.